I've been a nurse for about 12 years now, but when I first thought about going into nursing, AI was never a topic of conversation. It was never even brought up. I don't even remember a time in my first 3, 4, even 5 years of nursing where we even spoke about AI. It wasn't until recently, maybe the last 3 to 4 years, where nurses began to question themselves and ask, is nursing going to be safe in the long term? And for anybody who wants to get into nursing, is nursing the right option for me? So in this video, what I'm going to be talking about is the data and show you why nursing still is one of the safest career options for anybody who wants to get into healthcare. A major 2025 study broke down every healthcare job in 3 categories. Jobs AI can replace entirely, jobs where AI can take over big parts of the work, and jobs where AI is there to help you but not replace you. And registered nurses landed in that last group. AI isn't here to take your job. It's here to make the job faster, more accurate, and in some cases, less exhausting. But here's the catch. The nurses who learn how to use these tools are going to move faster, make fewer mistakes, and open more doors for themselves in the long run. And the ones who refuse to do this are going to be left behind. Right now, there are about 3.17 million registered nurses in the US, and that's almost 20% of the entire healthcare workforce. And nursing is one of the biggest professions in the country. And according to the OECD's 2025 Digital and AI Skills and Health Occupations report, it's also one of the safest from AI replacement. In the same report, you see the opposite end of the spectrum. Medical transcriptionists are high risk. Their main job is to listen to recordings and type them out, something that AI can do and already does in seconds. Orderlies, on the other hand, as the study calls them, are what we would refer to in the US as non-medical personnel. Or like, let's say, for example, somebody who transports a patient from one location to the other. Like, let's say you have a patient in the ER who has to be transported to CAT scan or has to be transported to the unit. That is what you would call an orderly. So orderlies are also in the high risk category because a lot of what they do can be handled by robotics. Then there's the potential automation group. Pharmacy techs, physical therapist aides, and medical equipment preparers are all in that bucket. They still need humans, but much of the work is repetitive and rules-based, exactly what AI and machines are built for. And registered nurses aren't anywhere near those categories. The work is too unpredictable for registered nurses. It's too physical and too tied to human judgment to be automated. It's not just one study saying this. Microsoft ran its own analysis of AI's impact on hundreds of jobs across every industry. They published 2 lists, the 40 jobs most affected by AI and the 40 jobs least affected by AI. Nursing didn't even make this list. That's not because the data was missing, it's because the risk is so low compared to other professions that it didn't rank as a priority in their findings. And the jobs most affected were all repetitive, desk-heavy roles. The least affected list was full of jobs that require hands-on work and quick judgment calls. Nursing fits that mold perfectly. You know, as nurses, we have to be able to think critically and quickly. As a nurse working at a call center, you are following algorithms. These algorithms show you which direction you need to take the call into. So let's say, for example, a patient calls in saying they have chest pain. They've been having chest pain now for the last 3 hours or so. Well, you as a nurse know that you need to follow certain protocols. And you learn those protocols because of the policies that the hospital put in place. AI can be trained to do those things, and it's already happening. There are a lot of hospitals that are working really hard to replace that specific role. There's a big difference between automation and augmentation. Automation is when AI takes the whole task and does it without you. For example, transcription software listening to an audio file and producing a document without a human typing a word. Augmentation is when AI works with you. It gives you a head start, catches things you might miss, or organizes the information so you can act faster. In nursing, augmentation could look something like this. AI drafts your shift note from your voice dictation. Scanning a med and having AI instantly check for drug interactions is another thing. Or pulling up a quick summary of the patient's history before you even step into the room. You're still the one assessing the patient, making decisions, and taking full responsibility, but AI is just speeding up the boring parts of our jobs. The OECD report points to 3 areas where nurses will see the biggest changes. The first one is going to be electronic health records. Charting eats up a huge chunk of every shift, and AI can help by drafting notes, organizing labs, and pulling up relevant details, but you're still the one reviewing it and signing off, which means you're accountable if it's wrong. And nurses who get comfortable with these tools will save hours every week. So as you can already see from what happened in the past when we even introduced electronic health records, nurses who had been working in the industry for ages and were using paper documentation quit their jobs and retired at the time that electronic health records were introduced. And the next thing is telehealth. Virtual care isn't gonna go away. AI is already helping by triaging patient concerns, pulling the right records, and even translating in real time for patients who don't even speak English. The nurses who can run these consults smoothly are going to be in high demand. So I highly recommend that you familiarize yourself with technology around you and how you can use it to your benefit, so that you are not one of those nurses that are left behind, laid off, like what's happening in certain hospitals across the country, including Kaiser Permanente and UC San Diego. The next thing is wearable health technology. Patients are walking in with months of heart rate data, oxygen levels, and sleep patterns from their watches and monitors. And AI can highlight patterns, but it's on the nurse to connect the dots and turn that into a real care plan. AI is moving fast. As I previously mentioned, when I first became a nurse, AI was not even spoken about in the nursing industry. But even though AI is fast, it's not human, and it can't hold the patient's hand when they're scared. It can't notice the subtle way someone's breathing changes and decide to act on it. It can't calm down a patient's family in the middle of a crisis. And it can't lead a code blue and keep a team focused when they're under pressure. So there's a lot of things AI can do, but it can't do many of the things that nurses are tasked to do. It also doesn't carry a license. The legal accountability is still going to be on us. And that's something that hospitals can't pass on to computers. The real danger isn't AI replacing nurses. It's other nurses using AI to do more in less time, and you falling behind if you don't keep up. Hospitals are already using AI for scheduling, staffing, and patient monitoring. And the nurses who can work with these systems are the ones managers lean on for important assignments and leadership roles. I see it all the time on my unit. The nurses who know the most are the ones that are at the top. Those nurses have more say in their schedule, more leverage in pay negotiations, and more chances to move into roles that they actually want. These are the type of nurses that don't have to stick to the bedside for the rest of their lives. And the ones who ignore these tools are the ones who end up stuck. And not because AI took their jobs, but because they became the slower, less efficient option for management. If you're thinking about becoming a nurse in 2025, you're stepping into one of the safest careers when it comes to AI risk. But safe doesn't mean you should just coast through your job. It doesn't mean you should just sit back and let things happen. Walking in with a strong handle on digital health tools is going to give you an edge from day one. By the time you've got a couple of years under your belt, you'll be the one with both the experience and the tech skills that employers are going to be looking for. That combination is going to be hard to beat. And it also means that you get to pick your own lane. Critical care, ER, oncology, L&D, these are going to be the specialties that require quick thinking and complex hands-on skills that AI isn't built for yet. Add tech literacy to that, and you're in the top tier of nurses employers are going to be fighting to keep. Nursing is still one of the safest careers that you can get into if you're worried about AI replacing jobs. The work is so complex, and it's too human and too tied to legal responsibility for AI to even take over. But there's going to be a growing gap between the nurses who embrace these tools and the ones who avoid them. AI is going to come to healthcare no matter what. So the smart move is to make sure that it's going to be working for you and not against you. I have a coworker who's a tech in my department, and she recently asked me if she should still go into nursing because she's trying to decide between radiology technician and nursing. And what I told her was exactly what I told you guys here in this video. Nursing is one of the least likely careers to be replaced. It will be augmented for sure, but it is not likely to be replaced anytime soon because of all of the points I laid out in this video. However, radiology technicians, on the other hand, although they are not going to be replaced anytime soon, are still more likely to be replaced, and there is less opportunity to move into different areas as a radiology technician than there is as a nurse. Do you agree with me in this video, or do you think nursing is going to be replaced sooner than we think? If you do, let me know in the comment section below. And if you like this video, then make sure you watch our other videos in our channel, and don't forget to download our app, Map My Pay, if you're a nurse thinking about moving to another city and you're trying to compare your home city's cost of living and salary to over 1,000 other cities in the US. Click on the link in the description below, or go to Map My Pay and download it there.